Did you know the health of your gums can directly impact the health of your heart? It's a connection that many people are not aware of, but as a dental specialist, I see that connection every day. Periodontal disease, especially in its advanced form called periodontitis, can affect your heart. These harmful bacteria doesn't only stay in your mouth. They can enter your bloodstream through inflamed gum tissues. Once they are in there, they don't stay confined in your mouth. They travel throughout your body, including to your heart. There is a huge amount of research that shows a strong link between gum disease and increased risk of cardiovascular conditions, including heart attacks, strokes, and endocarditis. The inflammation from gum disease can also contribute to arteriosclerosis, which is a hardening of the arteries. Protecting your heart health requires a holistic approach, and that includes your oral health. Routine dental visits and strong oral hygiene habits aren't just about preventing cavities. They are key steps on supporting your overall well-being. If you experience symptoms like bleeding gums, swelling, red gums, or persistent bad breath, these could be signs of gum disease that needs health care. These signs are not normal. If you feel this information is helpful, please click the like and subscribe to our channel. This will help more people to get this information.